As we continue to look at cranial nerves 3, 4, and 6 in oculomotor control, we want to look at eye alignment. And so you can look in Gutman on page 194. You can also look through pages 38 and 39 to look at eye alignment. And so here you'll need your pen light, and you're going to have your patient or client look straight ahead and then shine the light on their eyes. And what you're wanting to look for is the reflection of the light in their pupils. And you want to see if that light hits symmetrically in each eye. In some patients it may be slightly deviated, in other patients it may be significantly. So I would just about 16 or 18 inches away, just have them look straight ahead, and I'm going to shine this. You kind of aim right for their nose, and then you look at their pupils and make sure that light is hitting symmetrically in their pupils. I'm going to show you from this picture what strabismus may look like. So you can see here, if those pupils, if the light doesn't shine symmetrically in the pupils, sorry for the movement, then you'll notice a deviation of the eye, whether it's turning in, and that would be esotropia. Maybe one eye turns out, that would be exotropia. One eye may turn superiorly, so hypertropia, or one eye may turn inferiorly, which would be hypotropia. So this is strabismus. If we want to look at diplopia, that would be double vision. And so on this test, your screening book gets very specific about having your patient face a blank wall, and then you're going to end up getting behind them, and you're going to hold an object in front of them, again about 12 to 16 inches maybe away from their face, and you're going to test the different quadrants: superiorly, inferiorly, temporally, and nasally. And you're just going to hold the pen in different positions and ask them if if they see 1 or 2. Your screening book gets very specific and asks you to hold your instrument either vertically, horizontally, or diagonally. Okay, so for example, and it doesn't specify whether you're doing 1 eye or 2 eyes at a time, but for this time we'll do 2 eyes at a time. And so can you see the object in front of me?
Yep.
Okay, do you see 1 or 2 of them?
1.
How about now?
1.
How about now?
1.
Okay, if I want to be more intentional and be in the superior quadrant, I might come up here. Do you see 1 or 2?
1.
1 or 2?
1.
1 or 2?
1.
I can go inferiorly and do the same thing. 1 or 2?
1.
1 or 2?
1.
1 or 2?
1.
I could do the same thing and come both temporally and nasally to look for a diplopia.